Welcome to the Gutsphere podcast, where we bring you practical, science backed strategies to take control of your GI and gut health. I am your host, Bimal Maharzan, CEO and founder of Gutsphere, GI health advocate, lifelong learner, and someone who understands the ups and downs of managing GI health firsthand. At Gutsphere, our mission is simple to make GI care accessible, affordable, and actionable for everyone. With Thanksgiving just around the corner, we know the holidays can be especially challenging for those managing GI issues like IBS, GERD, or food insensitivities or sensitivities. But don't worry, we are here to help you navigate the feast without the flare ups. In this episode, I am joined by Daniele, a brilliant GI nutritionist, as we dive into proven tips and real life strategies to keep your gut happy this holiday season. From mindful eating and managing stress to creating your own GI soothing kit, we have got you covered. So, whether you are gearing up for a big family dinner or simply looking for ways to support your gut health, this episode is packed with actionable insights. Let's dig in and make this Thanksgiving one to remember for all the right reasons.
Disclaimer. This information is for educational purposes only and is not a substitute for professional medical advice. Always consult with your healthcare provider before making changes to your diet, lifestyle, or treatment plan.
Talking about Thanksgiving, what I really want to do was talk about how the symptoms flare up for GI patients. And the reason why it connected with me, so a few weeks ago, I made a video about feasting and fasting, especially around the festival times. And a couple of years ago, when I had severe chronic constipation, these are the times when the symptoms would flare up. So, and I would reckon it's common with other, patients as well. So I want to hear about thoughts like in this Thanksgiving and festival season, how are the patients? Do they flare up or what happens?
Yeah, well, I think one thing to talk about is a lot of the sort of maybe not typical eating behavior that it causes, right? To your point, sort of the feast and the famine. I think a lot of folks tend to, and this is in my opinion, born out of a lot of our like diet culture here, right? Save points or calories or whatever else, and we're counting and we're tracking, and we're sort of like these little accountants today. And that's not how our bodies work. It's just this organism that's chugging along. So I think some of the maybe most harmful behaviors that I see is this pattern of I'm going to save all of my blank for later, right? And it's not a great strategy or approach to sort of starve yourself through breakfast, starve yourself through lunch, and then on this empty stomach, you're throwing alcohol and you're throwing, some of these atypical foods, and people are bringing in lots of food into your, diet that you don't typically have. And the other thing I've recognized over time with a lot of my GI patients is they have, I think, sort of self-managed a lot of their dietary triggers, right? So a lot of times I'll talk to someone and they just don't eat something. And I ask them why. I don't really know. And it gets worked back and they're like, I remember why I don't eat this, right? So some of those things that maybe they wouldn't have cooked with the blank, but Aunt Patty does. And Aunt Patty had it in there and all of a sudden they have, right? So that can certainly be something. I think some good advice around that is one, just don't do that. Don't starve yourself and, go on your turkey trot on an empty stomach and then go to the Thanksgiving and, use all your points or your calories or whatever it is. Really give your body what it needs when it needs it. Realize that our bodies are in balance most of the time. We really want to try and keep that balance. There is this sort of like time limited feeling, this sort of like urgency around some foods. Like Aunt Betty only makes this pie once a year. I love it. I'm gonna, whatever it is. Okay, cool. Fine. But sometimes I'll explore with patients, right? Like, what is it about that food? Is it that you love, pumpkin pie spice? There's a lot of other ways. We could make you oatmeal with some pumpkin mixed in, some pumpkin pie spice and some brown sugar on top. Like that could be something you could have any day of the week, right? So really trying to sort of desensitize some of those flavors and make them a little less on a pedestal too throughout the week. You can make stuffing at home the way that it wouldn't hurt your stomach. You don't need to wait for Thanksgiving to do that either, right? So you can maybe enjoy the portion that doesn't feel like it would be too triggering at the actual celebration.
As you were speaking, I told you earlier, right? We had the same, which is the main event, and also Thanksgiving dinner and so on. I enjoyed that so much. For many years, like I would just have a fear of getting it because there's so many great food, I can't enjoy it. And first few years, what I did was I ate a ton of food anyways and struggled through the next phase. Some of the struggles I had was like, obviously I would have constipation that would lead to hemorrhoids and I would have bleeding for many, many days, so on. And that would be the consequences of me celebrating it. But however, then I said, being a scientist of my own body, trying to learn how to prevent it, then I became really good at it. So this is what I did. I'm not speaking for everyone, but speaking for myself. So what worked for me was obviously going into the festival, the big meal. I would plan earlier for many days in advance. Meaning, I would stop eating a lot of fatty foods, a lot of spicy food, a lot of heavy foods early on. I would make sure that my bowel movement is clean. So that's how I would do. I would drink a lot of water and so on. So going into the day and before, so I wouldn't have big breakfast or big lunches. I would have smaller breakfasts and smaller lunches. And even during the big meal, there is always spread out. There is an appetizer, there is a main course, there is a dessert, and so on. What I would do is throughout the day, I would hydrate myself a lot, and I would walk around a lot. And during the meal, I would sit down and eat really slowly. And even the order of the food, I would start with the green vegetables first, I chew it really properly, and then I would take on a meat. For the record, I eat turkey. It's too dry for me. Like turkey at all, but I would eat it. If somebody prefers food, I would eat it. Then I would eat it very, very slowly. And even in dessert, I would eat dessert very, very slowly as well. So after that, I would be sipping on the warm water. And if there is a place to walk around, they'd walk around a bit after dinner as well, stand. Or what I would do is there is a sitting position in yoga. It's called Vajrasana. What typically means is you are folding your knee and you are sitting on the heels. So what, I don't know the scientific study for this. The assumption or the logic behind it is that it will just improve the digestion because it will improve. They call it fire in the stomach area or abdomen. So that's how it will do. It will help in the digestion. So I would sit on that, and then so next day around, I would not still eat heavy breakfast and so on. So it's like starting slow and peaking it, and then gradually coming down. And after multiple years, I was like, oh my God, I could seriously enjoy every food. One more thing which used to trouble me a lot was the stress going into festivals. Hey, the stress going into festivals, like even something like nocebo effect. Hey, if I eat that, I'm going to have the problem. And then subsequently, I would have that problem. Then even the reframing it when I have, okay, this is something that I control. And then I didn't stress about it. That also eventually helped me in some ways, right? Or not have that. It's like not have the nocebo effect. That also helped. And third thing, which I did a lot was, for me, because of chronic constipation, fiber all this, I was drink a lot of water, and that helped. And those are things I do, and that I said, right? I wrote in my book as well. It's like preparing like an athlete. So it's a boxing match, right? Recently there was like Mike Tyson versus Jake Paul, right? Okay, like kind of the boxing match. I need to prepare for it. And then when I prepare for this with the right mindset, okay, I'm going to prepare with less food in the morning so that I don't want to overload my digestion system, right? Yes, I'm going to most likely overeat a lot, but simply because there are going to be so many courses and they're going to eat for a longer period of time. So, but at the same time, how do I minimize the negative consequences of slightly overeating? So I would
Yep.
prepare for that. So therefore, I would eat less in the morning, then still gradually eat up, then do not eat anything after that, drink a lot of water, and I would avoid alcohol at all cost, because that again works really bad for me. I learned from that experience, so I wouldn't drink any alcohol. Now, for the last 4 years, I will go have a big meal, enjoy, come back, and not have flare-ups at all. So that's what I do. I just wanted to share with you, like, because what you were saying to me was so, I could connect with that, and I was like, I have to share my experience.
There's so much in what you said. I'm like trying to make sure I remember the points that I want to say, because and I'll outline them first so that I don't actually forget, and you can remind me if I do. But I heard mindfulness in there. I heard sort of cumulative risk, and I'll talk about what I mean with that. And then that sort of this idea of overeating as well, right? I think we could conceptualize it in two different ways, and I think they're both relevant for Thanksgiving. And one is I use a hunger scale a lot with folks, and by a lot I mean with everybody all the time, which is sort of 0 to 10. Where are you? 5 being neutral. As you go up, you get more full. As you go down, you get hungrier, right? So we could think of, when I think of overeating in a traditional sense, I think about, okay, you're past your point of comfort on that hunger scale, right? So they might identify to me, I was an 8, I was a 9, right? I ate, I felt my fullness at that point, and then I kept on going, and I'm literally over full, right? And then I think for some of my GI patients, the idea of overeating can also be, I got exposures to foods that I don't typically eat, right? So I'm symptomatic because I also have a new food exposure that didn't feel great. And I think that can sort of be filed under this overeating, right? Because what is overeating? Well, I eat an amount of something I don't normally eat, right? Like I overate the pasta sauce and now I have GERD. Well, is that because you were super full, or because you went past your point where you typically experience symptoms, right? So when I think of overeating, I think of those two things. I think about physical fullness, just regardless of the food, where you are on that scale. And then also in terms of like a food trigger, I exceeded my tolerated sort of tipping point for being symptomatic. Because most people, if they do have a GI food trigger, they can tolerate X amount of it, or they can tolerate a certain combination of it. And that's actually a great segue into the other thing you said, this idea of like cumulative risk, right? And what I'm hearing from you is, I don't go in a flare. I go in as calm as I could possibly be, right? I get myself in good working order to sort of go in. And when I talk to my GI patients, I talk to them about how multifactorial our GI symptoms are, right? Very rarely, and it happens, but very rarely is it this one thing causes this one symptom in the exact, at any amount in any situation, right? There usually is a bit more to it than that. And sometimes I'll use this sort of cumulative scale, right? Where let's say, and we try to identify, what are my mild triggers? What are my moderate triggers? What are my severe triggers, right? So maybe a mild trigger would be a hormonal cycle for a woman, right? Like I'm on, the week before I'm going to menstruate. Okay. I know I'm already +2 going into here. Okay. Now I'm eating this food that's a +3. I'm at a 5. Uh-oh. At a 7, I'm going to have symptoms, right? So what are those +2s? And what I'm hearing from you is dehydration. Okay. I'm going to be hydrated. So that's -3, right? Like I'm going to avoid that extra plus, so that you're not getting to that point where you're at that symptomatic sort of push and you can tolerate more. This is not a pitch for it at all. I don't have any affiliation. I'm not, what is it? When you give a presentation, you have to give a
Disclaimer.
yeah, I have no affiliation with it, but there are also enzymes for folks specifically geared towards some of those starches that create digestive issues for folks with IBS, like FODzyme and FODMate. I don't recommend them necessarily for every single day and every single meal because it can get expensive. But times like these might be a nice, just in that like cumulative risk space, to take away some of the +3s, +2s. You can look into those for big events like these where you might not be able to avoid the XYZ that you're going to get exposed to. And then mindfulness, huge, 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 huge. Both from just like a physiologic digestive standpoint. And I think also from a behavioral standpoint, right? So your body is going to function better and be more receptive to digestion. Digestion is supposed to be something that happens at rest, right? So if you're not and you're super stressed, that's going to prevent digestion or optimal digestion, right? And then the other thing to think about is if you've ever been in a kitchen during the big meal preparation, they're cooking for hours. Everyone's stressed about the potatoes. Like there's just it's a coordinated effort, right? And so people are just grabbing and snacking and tasting, and they might not be realizing what they're eating, how they're eating. They may be swallowing a ton of air. They may be eating really quickly and not chewing really well, right? So to your point, I also think make sure that you're sitting down, enjoying your food if you can. If you're hosting, maybe have a plan around that, like literally make breaks for yourself to feed yourself, and not just sort of in the whirlwind tornado of what's happening, trying to eat. Really try and set aside time to enjoy a meal and chew and take a deep breath and all of those things too. Ha, I think that's it. I think those are the things.
Right. So, uh, few things to unpack there, right? You said like mindfulness. Second thing is about this overeating stuff and the cumulative stuff. Cumulatives. I think cumulative makes a lot of sense. And also you talk about enzymes. So before I forget about the other things, you talk about enzymes, obviously. Are there any natural ways
Mm.
of improving the digestion during that period of time? Because I know some which I do.
Not to my awareness that I have some good evidence around. I think the chewing, digestion starts mechanically in your
Mhm.
mouth.
Yeah.
So chew, 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 chew some more. And then the rest as well, just from like a physiologic standpoint, from an
Mhm.
actual uh, something taking sort of exogenous action on the
Mhm.
food. I haven't, I'm unaware. Yeah.
Okay. So I generally I try to prevent taking the additional enzymes or supplements because, as you said, it can add up and be very expensive. So, what are more natural ways? So, I'm going
Mhm.
to ask you to do about three things. Maybe the one thing is many people talk about drinking, uh, let's say apple cider vinegar before eating any food, and how does that's number one. And second thing is I've also heard about, which I've done this personally as well, eating some ginger with little salt and lime in it and chewing it before. That's second. And third is, this is mostly coming from the Eastern side of things, which do we do it? Chewing fennel seeds after eating food. So your,
Mhm.
there will not be any, studies on these things, but logically speaking, apple cider vinegar, the chewing, let's say, ginger with lime, with a little bit of salt before eating, and post meal chewing fennel seeds.
Yeah. So, I mean, ginger is sort of generally accepted to be
Hmm.
a helpful sort of
Hmm.
gastric soother, if you
Hmm.
will.
Hmm.
I'm not sure the rationale behind it. I know, I believe like licorice root, things like that. I don't think there's a lot of strong evidence, but the idea is it helps with some of the mucus production in the stomach to help protect the stomach barrier a little bit more, from
Hmm.
all of like the acid and everything else. From a digestibility standpoint, I don't know. I have no idea. And I would put fennel with the ginger in my mind of that one lack of my knowledge around it, but the way that I understand it to be soothing. And I don't totally know the implications on actual digestion.
Right.
Um, apple cider but I do think, and I think this is a good point to make, if it doesn't pose a ton of risk or harm, and I would categorize that as you are taking a supplemental form that somebody else did something to,
Right.
concentrate it, adulterated it. If you want to have some ginger tea, go for it. Like ginger tea
Right.
is not going to hurt you either way, right? So,
Right. Right.
if you're assessing some of these strategies too, I always look at, well, what's the potential harm, right? If you want to throw some turmeric into your cooking, phenomenal. If you're going to take a super concentrated, turmeric capsule with a bunch of other stuff in it, well, that's a little different, right?
Right.
So I think looking at the sources, looking at the potential harm, we always want to protect the liver. I
Right.
don't care about our liver as much in the supplement world. I don't think it's
Yep.
talked enough about. We are giving whatever we eat, our bodies have to process. They have to do something with it. And there a lot of times is a greater concern for liver toxicity than there is of potential benefit for some of these things. But if you're having it in the food form, that's very
Right.
rarely the case as well, right? So eating a little fennel, having a little ginger, like
Yep.
great. The apple cider vinegar, I've heard of this a decent amount, as I've also heard of like a lemon water. My guess is the point would be to add a little bit of acid. I don't know anything about it in terms of I've read these studies on it. I have no idea. Maybe there's some evidence for it. I don't know. To me, mechanistically, that would have to be maybe if you had, low stomach acid,
Mhm.
adding acid. Maybe. But I think the thing to remember is your stomach is acidic, right? Naturally, usually. That's its whole job. That is part of its digestive juice work, to sort of break things down for you. So consuming it, who knows? There's a little bit of research around having an acid with meals to help with blood sugar. But that looks like something like a salad dressing. I think people take that a little too literally and they end up drinking a cup of apple cider vinegar. And then I wince for all of my people with already with acidic stomachs and GERD and all of that. That makes me very, it feels very ouch. But again, if what works for you works for you, I would always encourage people to look at potential harm, right? My
Right.
bigger concern as a dietitian, if you tell me that I'm not equating these things obviously, but as a ridiculous example, if you were to spin 7 times on a Sunday and it is somehow helping your vertigo, okay, like as long as there's no tile floor, maybe you have some pillows around, right? I think we are, as we've spoken about before, like we're our best test cases, right? We're our best case study. So, I just always encourage people to look at, is there a potential harm in this? Because I think sometimes we assume that things are benign because they're on the shelf and they're marketed to us. And we presume a lot of therapeutic benefit from food, but yet we don't look at the other side of that if it's powerful enough to make a good difference, it might also have the power to do harm. And both are usually true. So just always looking at that other side. That's my
Got it.
soapbox. That's my dietitian soapbox on being careful with
So,
those.
so yeah, it's also curious about the concentration and the quantity of the things that you're taking. Uh, For example, let's say turmeric. So turmeric, we have known for, so the turmeric is used in the Eastern cooking. In all our cooking, we add turmeric. So, but this is amount. It's always a pinch, never a tablespoon of it, never a like teaspoon of it. It's always a pinch. So, whereas these days, I see a lot of people talking about, taking a very concentrated curcumin supplement, right, in the
Mhm.
form of capsules, and there is a risk of harming your liver because at that concentration, you cannot even, liver can't handle that toxicity at all. So again, this I see that turmeric capsules everywhere in the supplement sections and all, right? Maybe you can try it out also out for yourself. Again, weighing it, cost benefit analysis. Okay, it benefits you at what cost? Cost is almost negligible. That's where things like chewing some ginger may be harmless. Uh, Drinking fennel seed may be harmless. Drinking peppermint tea may be harmless, right? Those kind of things, they're harmless. And if you try for yourself, which I did, that's the reason why I know about these things is I try for myself. Right? Another
Yep.
thing which I talk about is, which I also do not tend to do is, so usually another problem is like this festival are the big meal is during the night, like
Mhm.
during the late evening and night. And then that's where maybe you can speak about how the circadian rhythm and what one can do post big meal in order to slightly increase or give it, let's say, negative. We talk about the cumulative impacts, right? Which decreases the cumulative negative impact of it. What we can do post meal as well.
Yeah. Well, and I think my very annoying answer
Yeah.
is to do all the things to really not get into a situation where we're overeating so
Right.
significant that we're left with that, right?
Mhm.
I don't think we need to go past on that hunger scale like a 7 or 8. Of course we do and we can, and it's fine. And I think that was
Yeah.
a really insightful thing that you said too of, you know, the stress is the stress, right? Like being anxious about our anxiety, being depressed about our depression, right? Like being, nervous about the food, it's really not helping anything. So realizing, listen, my body is meant to handle these things. I can handle acute periods of under and overeating. I'm gonna be okay. This is gonna resolve, right? And sort of coaching yourself through like this is okay. I had someone recently, relatedly, she's always had problems with sleeping. And they were getting worse and worse and worse. And she's going to different doctors and she's trying different medications and all of these things and just keeps getting worse. And she listened to a podcast and had come in the next week and was like, you will never believe this. What ended up helping, and she wasn't cured. She wasn't like the best sleeper going from sleeping 3 hours to 8 hours, but she just stopped everything else and stopped worrying about it so much. She was like, I realized my anxiety about not sleeping was I was stuck in this loop of I would go to bed. And I was so stressed about whether or not I was counting the hours and the minutes and like trying to test the medications, right? She was so in her head about sleep. It was preventing her sleep, right? Like it was the problem, right? So I think very relatably to the food, right? Like it is what it is. Let it be what it is. Don't stress about it. It's okay, right? Our bodies are meant to handle the food like that. In terms of like soothing aftercare, I do think a nice little like some movement, some gentle movement, some stretching. I think this idea of, and I think the orientation and the framing around that needs to be really strong. And what I mean by that is, again, don't let that sort of, it is plucking from the diet culture playbook a little bit of like, you ate, now go exercise, which is quite disordered, right? But in a GI world, the better frame is, okay, I have an input. I'm going to help the sort of middle ground before the output, right? Like I'm going to help this process move along a little bit. And what does that look like? And I think people are, when they have that frame and that lens, it's a lot easier to accomplish because I think the bar is a little bit lower and it's a little bit more aligned with themselves. Because in the other one, it's I have to go run a race or I have to go walk 5 miles or I have to go do all these things. And if it really is movement that we're looking for, if it really is digestion that we're wanting to help with, to your point, standing up, right? Go help. One tip I give is go be the best guest in the entire world or the host of someone's dreams. Like go clear the dishes, go start moving around in the kitchen, right? You get a twofer. You get lots of, pat on the back, good job, helper. And you're up and you're moving and you're kind of doing that. Meditation, some nice deep breaths before, during, and after. Noticing, and this is a good thing to practice beforehand. We don't want to go into Thanksgiving and say, today is the day I'm going to be mindful around my food, right? To your point beforehand, get some of those skills, start doing stairs like Rocky before the big fight, and really try to notice, where am I after breakfast? Where am I on that hunger scale? Am I right dead center in the middle, just neutral? Am I really full? Am I still a little bit hungry? Try to get some of that attunement and try to sort of hone that interoception and that mindfulness beforehand so that when you're in the meal, this is why we do fire drills, right? When you're there, you have a little bit of a script, you've practiced a little bit of a thing. When you're working through that Thanksgiving dinner, you may notice more automatically, oh, okay, I'm full. You have a choice at that point. It doesn't mean throw your fork across the room and leave the table full. But you can just have some more awareness around, okay, I'm at a 6, I'm getting to a 7 on that hunger scale. I go and eat. I'm not going to feel super great. Now I have to make some value assessments for myself. I have to make some decisions. And if it comes to the pie that's on the table, okay, I'm a 7 now. I'm still going to be here for another 3 hours. And to your point with that timing, right? Digestion is going to keep happening. So in another hour or two, maybe my 7 or my 8 goes back down to a 6 or even a 5, right? And maybe then that may feel better for me. Right. But you can't do that if it's, oh my gosh, here's the food. It's here now. I'm never going to get it again. How am I going to get it? I need to get it now. And there's almost an urgency, honestly, with folks. Let me just get it done because it's so confrontational. This idea of having to make these choices that I have 2 divergent interests. I really want to taste it and I'm going to feel like crap. Right. It's so stressful even to have that situation on the table. They just want to get rid of it. And if I need it, the decision's gone, right? I don't have to sit and tolerate that tension anymore of that decision. So give yourself the time. And also remembering, if you want an apple pie, if I wanted an apple pie for lunch today, I can have that. I can go do that. That's not, right? So some of these foods that do feel really, really special and uncapturable, is that because it really is Aunt Patty's recipe that nobody else knows? Or is it because you've restricted yourself from some of these foods, and those restrictions don't need to be there. And you don't need to fit it all in this day. You can continue to enjoy these foods outside of that.
Got it. Double click more on the Thanksgiving side of this, that food in the Thanksgiving way. So what are different sauces? And we also unpack with different GI issues from top to bottom, from the GERD to SIBO to IBS to IBD. What are people should avoid in general, and what they should do to decrease that negative cumulative effect. So can we just go a little deeper on that part?
Yeah. So I don't think one meal is going to really do all that for your chronic GI condition. So remembering that, I think another sort of like core tenet to remember is that most of those things are dose dependent. If it's a known trigger, have a little bit, see how you feel, right? It doesn't need to be sort of an all or nothing endeavor. It doesn't need to be, oh, I never get to eat this food, I'm going to eat all this food. It can be like, okay, I know I'm a little sensitive to this. I'm going to try a little bit and see how I feel. And yeah, I might feel not great later. And again, I will get through it and that will be okay. That one meal is really not going to do too crazy much unless if you are allergic to it, please do not. An important thing to remember for enzymes, particularly. So if you're lactose intolerant, for example, or if and that's a really easy, lactate pills are available everywhere. A really important thing to remember is they're only working with the food as you're eating the food, right? So we see this sometimes where it's something as simple as lactose intolerance and you think you've got it, you're good, you've handled it, you've managed it well. Because of the time frame of something like Thanksgiving, if you take, a couple of lactate pills before the brie appetizer, that is not working for the milky mashed potatoes later on in that meal, right? So remembering that you do need to follow the instructions on the box. It does say this on the box. This is not novel, dietetic insight. This is in the instructions. You want to take it with those first bites of dairy or before so that it's there to work on the food as you're digesting it. So remember that too. If you do take enzymes for help with digestion, you can't take them at noon and then at 2:00, you're chatting with Uncle Larry and all of a sudden, I don't know where I'm getting these names from. I have no aunts or uncles with these names, to be clear, but you're chatting with him, you forget about it. And then you go to have something that's full of dairy and, oh, I took my lactate pills, but it's actually been like 2 hours and you need to go take some more. So that's an important thing to remember. Again, for something like SIBO, you're going to need antibiotics, but the carbs, those gas producing foods, having some gas X on you never hurts, right? It's not preventing gas, it's breaking up gas. So that can be really helpful just for your own comfort later in the evening. Again, we're at social things. I think that adds a little bit of extra stress or pressure, right? Like, oh my gosh, I'm going to be a hot air balloon by the end of the night. What am I going to do? And I can't relieve myself, right? So that can sort of like build things up too. There might not be a good bathroom to use. Like those are things that are really stressful for folks with the GI stuff. So you might want to have over the counter med help there with some gas eggs and that. Even if you're borderline lactose intolerant, maybe that day is not the day. We play it fast and loose with the lactose sugars, right? So I think, to your point, sort of getting all of that with something like GERD higher up, try not to be overfull, try to walk around, go in, knowing your food triggers and knowing that you might have a little bit of GERD. You could try some alginate products as well. They kind of float to the top and help make a little bit of that cap. So Reflux Gourmet, and this is all over the counter. I do not prescribe things. Just feel like I need to make that. But yeah, things that are helpful for coding and things like that. Those little assists, right? Some Pepto, some Tums, like maybe you have a little GI soothing kit ready to go.
GI soothing kit ready to go. That's the GI soothing kit. Okay, we are going to brand that thing. We have to create a resources section where it's got GI soothing kit for Thanksgiving.
Absolutely. And I will, now that I'm saying that, a couple things that I would make an exception. EOE, like eosinophilic esophagitis, gluten allergy, celiac disease, these are not things that are dose dependent. These are things you will have a reaction. So please just avoid those. And you just have to kind of know what's on the menu beforehand. and just make sure that you're not getting even cross-contamination with some of those products. And likely if you have celiac disease or, EOE, you've been dealing with this. You kind of know the drill on how to inform people. Hopefully the people that you're going to see know you and are used to that at least a little bit, or there is an advocate for you in that space that can help with some of that stuff. I consider it a nut allergy. It's, if you have a little bit, you're going to maybe not have anaphylaxis, but there is going to be sort of that mucosal reaction. You're going to have damage. And we don't want to get people to, and again, do people get exposed to gluten with celiac disease? Yes. Are they fine? Yes. But that is something we would want to avoid that isn't dose dependent. There are definitely things like,
Right. Even the independent of doses, even the slightest touch, you get allergic reaction, or you get like escalation of this, these symptoms. So I also want to talk about another thing, which is independent of food, with triggers for GIs. For example, and this is true in the US, like because of travel. For example, for Thanksgiving, your family lives in the East Coast, you're living in the West Coast, you're coming in here, your circadian rhythm changes because of that time with fetal changes. How does that impact the symptom flare up during this Thanksgiving? That's one. And also about even in general timing, right? Timing about when you're a host or when you are a guest. So when you're a host, you have control about when to have dinner time, the meal time. But when you're a guest, you don't have a control over meal time. And then, okay, that meal time may not be, for example, I usually have dinner at 6 p.m., but again, that time may be 8 p.m. somewhere else, right? How does the timing, and two-part question, like how to deal with that?
My first thought is I don't actually know. So I will give you my opinion and how I've seen it play out, but I don't actually know. And I don't know if that is in the literature or not. But I do think there's a couple of things that are really relevant there. Again, just anecdotally, but I think there probably is a bit of evidence for which one we get cued around these things, right? We do have a sort of stimulus response to the peristalsis, to the relaxation of our muscles, let us go to the bathroom. So when we get out of our environments, we don't have those anymore. And that can be a challenge in and of itself, right? I had a client who had a child who was having difficulty with constipation and they weren't ever able to go at school. And I said, okay, well, maybe you tell them, try and get a little routine going. Well, now, like clockwork, it started happening after lunch. Now, every time the kid even saw lunchtime coming, he had to go to the bathroom, right? Like we really are, it is that Pavlovian sometimes, right? And we've lost all of our cues when we're outside of our element. So that's one thing to consider. So you might want to have as much cueing for yourself as possible. So maybe even in this other place, you get up, maybe at home, you get up, you drink a big glass of water and you do some stretching. Try and still do that, even at the different time, even in the different place. Like try to create as much structure around your normal day as you would. Maybe every morning you go for a 5-minute walk and then you do a 5-minute stretch at home. Even if it's a pain to do that, or it feels like you're in an alternate reality, because that's what happens when you travel, you're on some sort of different Twilight Zone, even though life is the same. Still do it, right? Like still go out of your way to do it, because that will help, I think, cue yourself a little bit better. And then the other thing about having the different time frames, and I hear what you're saying, where it's like your stomach is used to noon, but noon isn't noon anymore, right? So I was at DDW, the GI conference in DC, and I met a bunch of my GI RD colleagues that I had never met in person. It was very exciting. And somebody needed a snack or forgot breakfast, something. And now I need you to imagine a bunch of dietitians, all of us open our bags and pull out snacks for the person, right? Like we all had, and it was like this funny joke of like, try to catch a dietitian and look at a dietitian's bag. We have snacks, right? And I think this is exactly right? Like if you're trying to attune and figure out where you are real time, I would say eat when you would normally eat. Don't try and pretend that that's not valid anymore just because you're in a different time, right? Until you adjust to it and you're not feeling those cues. But maybe have something on hand for these holidays, whether that's you run to the store and get your favorite trail mix or something that you can have on hand. Or maybe there's a nutrition bar you like that you can travel with, that you can use in, scenarios like this to put in your pocket or your purse or, whatever it is. But I would say, meet those needs. And you also don't have to meet them fully. Let's say you normally eat lunch at noon and you get that sort of twinge at 10. You don't need to get all the way to a 7 or an 8. You can get to like a 5 with that stuff. And then in an hour and a half, maybe you're back down to like a 4 or a 3 and you're ready for that full meal again. And that can sort of titrate it over to the new time. But I certainly wouldn't ignore that hunger cue, if that makes sense.
That makes a lot of sense. I think cues is a good way to think about it. I think that's where looping back to our think about awareness about our own body. These days, more often, we are eating according to the time, not to our bodily cues. And
Totally.
because we are eating according to time, then we can understand our cues as well. So, for example, cues, understanding if you're aware about it, then this is what I do again. I do, especially when you're traveling as well. I don't pack. I stop eating anything anything I have to tear. I don't eat it anymore. Occasionally, I make an exception when there's nothing else. But what I would do is I carry nuts, dry fruits, the almonds, cashews, pistachios, right? And whenever I'm hungry, I'm not. I'm snacking with a little bit of that, especially when time difference when I'm traveling West Coast or I'm traveling Nepal. Right? I'm snacking on when I'm hungry, and I'm able to read that cues because I'm not eating according to time. I'm eating according when I'm hungry. So that's another one. And then when there is a big meal, obviously, start with you see a you see your face, you become hungry automatically. So again, then indulge. So that's one. The second is when also about cues, you're absolutely right. Cues that you can control. For example, maybe for many people who wake up and start exercising, go to the gym, right? So you can carry a gym everywhere, right? You can, but sometimes, but again, what you can carry is you can carry your body everywhere. Maybe there is like your body weight exercises. Maybe you can do some push-ups, some pull-ups, some stretching, some good those kind of things in which you are not dependent on any other externalities. Everything you have in control, and then I do that, right? Cues is whenever I go, I stretch up and things. Another simple thing which I do, regardless of which I control and not dependent on externalities, is as soon as I wake up, drinking water, right? So even if like I know there's a lot of things that you should not drink from plastic bottle, but when you're traveling, right? So drinking water versus drinking water from the plastic bottle. Which one is less harmful? Maybe sometimes, like if you don't drink at all, that is more harmful. But occasionally drinking plastic water, maybe my body can handle that, and my organs can release the toxin. So from the drinking water, right? So from plastic. So I drink anyways. So this is again, what I think about is this is something that I control. There is no dependency on the externalities. And those are the cues those are constant everywhere I go. And then that is regardless of the time zone I am in, regardless of the home I am at, regardless of the place I am at, I control these things and I do that and and that helps me, let's say, recalibrate or reset my digestion time. Does that make sense?
Yeah, totally. And plastic bottles, I think especially with food, it's a piece of our environment, but it's only a piece. There are so many different things and so many different exposures that we take on. And knowing that you're never going to get to zero, right?
Yeah.
Like you're just not. Even, I had someone, a client email me and say, "Oh my gosh, P, it has heavy metals." And I'm like, "Well, plants have heavy metals, right?" Like it's really tough. And in microplastics, and it's like, yeah, in everything. So I think it's sort of where can I reduce my risk that feels comfortable and happy for me? And where is at the point, like we were saying before, where I'm creating more stress than help, right? And finding that balance, like, okay, I don't want to drink out of plastic bottles for 10 different reasons every day. But when I'm traveling, staying hydrated, and this is a totally fine exposure, and sort of like figuring that out. And hydration is a very seemingly, I have a lot of hours of nutrition counseling that would say otherwise. But staying hydrated is a very simple thing you can do, right? It's actually not simple, especially just because we're so busy and it's such a just a hard thing to remember, and it's so redundant. People get sick of it really easily. But it is one of those things you can sort of actively include. It's probably not unless you are having way too much of it, or you're being really obsessive around the amounts. It's really not going to create too much harm for people.
Yep, I think agreed. Also, I can share some experience, my own experience about like hydration. So our cue is that we get thirsty, right? So in my experience, what happened was I did some of the others. When you are thirsty, if you do not drink, your body gets a response that, hey, I'm not getting the water that I need, even if I'm thirsty. I'm going to manage something else, right? Something else. Therefore, maybe like drawing more water from the colon, or right, doing something else. Therefore, what happens is your body is dehydrated, but stops giving cues of thirst because you're not responding with water when you're thirsty. And that gets into a vicious cycle. But again, when you start actively building the habit of drinking, then it gets reset. Okay, now body is giving you the cue you're thirsty, then you're drinking it, and body is getting the reward of that quench. And therefore you get more thirsty more often because your body is getting the reward of the quench. Whereas you stop drinking it when you're thirsty, body is not getting the reward of the quench, then say, okay, I'm going to manage somehow else. And then get into the vicious cycle of it. And that's what I've experienced of it. Now, these are actually more thirsty every, let's say 30 or 50 minutes or something like if I drink and I drink it. Previously, I would drink for hours. I would still drink thirsty. That was during my constipation times.
Yeah, I think the thing, and I'm thirsty actually. I like have my water. Yeah, this is making me thirsty just talking about it.
Right.
But I think one thing to remember about the body and a big takeaway about our physiology is we want equilibrium. We like balance. And there are a lot of different mechanisms in place to establish that. If any of the alarm bells sound that we are out of balance, right? And remember that we have so much fluid in our body, right? And we're not absorbing it from the environment. In fact, we're losing it. As we're talking, we're losing it, in a variety of different ways, not just when we go to the bathroom, right? So I think in the water content of foods can be a significant contributor, but then there are days where it's not at all too. So some people say to me, I felt really dehydrated on this day, but I felt like I had the same amount of water. Well, if it's a summer day and you're having a salad and you are eating a soup and all this, it might not be quite the same. So yeah, there's a lot of alarm bells. Your blood pressure is a big deal, right? And your blood volume matters. So there's a lot of different alarm bells that can sound in the body. And to your point, it's gonna get what it needs. So if it needs to take extra water from the colon, it's gonna meet its needs to stay there. And also I'm forgetting. I don't like to say things unless I can remember the source of where they came from, because I don't want it to be from like TikTok, or it could be, but just would like to say that. But your brain literally shrinks when you're dehydrated, right? Like I also think that it's one of those things like sleep that it feels like such a duh, right? A lot of the work I do, it feels like a duh. It's like, fruits and vegetables, balanced meals, it feels really straightforward. But I think because of that, we give it less weight into its impact. And that's not the case at all, right? Like sleep is so fundamental to our health and our well-being. Hydration is so fundamental to our health and our well-being, right? And adequate nutrition and nourishing our bodies is so fundamental to our health and our well-being. And I think because we've heard it so much, it's a little bit like, go do your homework. It's like, yeah, I'll do my homework. Like there's a little bit of like an eye roll. And I've had people really commit to, I'm going to stay hydrated. I'm not going to, drink 7 gallons of water a day or go crazy. I'm just going to be mindful of staying a little bit more hydrated throughout the day. I'm going to be mindful of feeding myself throughout the day and responding to my hunger cues. I'm going to, brush up on my sleep hygiene and make sure that I'm trying to adequately rest my body. And the way that they are floored at the result, right? Because it doesn't feel like it would be that impactful, but it really, really is. For in a lot of cases. For some people, there's something more complex going on, and there's some, more organic disease that it's related to. But a lot of times, these are things that can be really supportive.
Correct. A lot of time is still, sorry, a lot of time it's simply things that you're doing incorrectly. And we're talking about that, right? Incorrectly meaning, so when before the industrial revolution, people woke up on time because there was no electricity. So you have to wake up with the sun and go to bed go up with the sun, right? So the circadian rhythm was just naturally there. People didn't have to think about it. And now, I mentioned earlier as well, we're deviating away and away from our evolutionary past. So our body is a machine. So it was designed to operate in a certain way. And our machine did not come with the manual. So therefore, so most people don't know how to take care of their body. That's where people like you come in, would know a little bit more about the manual and say, and all the things that you say and all the things that sounds, everybody knows it. But again, you don't know it because if you know it, you would do it. And again, sometimes you also need a little bit of push to do it.
Well, and I would argue our lives are not designed for people to do it, right? Like what we get told is it doesn't matter how you're feeling, go back to work, right? So it's a lot of my folks that if they were able to exist, right? It's all of the other pressures of life that come in and make it nearly impossible, right? So then we come in and sort of strategize together. Okay. And like we've been doing this whole time, like what's our cost benefit? What is the highest priority item for you? Where are we going to get the most benefit? And let's focus on that. But it is, in my opinion, a huge failing of our sort of culture of work some more, right? Where rest is not a virtue, it's a weakness, right? And self-care is like I think it can sometimes become a little bit of like self-care, but get all the things done that you need to get done and do all of the things. And also we're not, right? There's not a lot of buy-in for the self-care from the places that it matters for it to be, right? So there's this crazy expectation on folks, but I know we have to wrap up and that's a bigger topic.
That's a big up. And also one last thing, which I want to say is it's also about communicating what you're dealing with. For example, many people are ashamed about talking about, again, you talk about burping, you talk about farting, you talk about gas, you talk about all the symptoms about it, and people silently suffer. And I think, and also if you're just getting with the host, okay, what problem that you have and what problem, even in a dining table, you're eating with some people and you'll say, okay, I'm not eating this. Yeah, I cannot go beyond this point because this is the reason why. I think being communicating is important as well. And to anybody's surprise, most people will just be very accommodating, right?
Yeah.
I think it's stealth, let's say, shyness or hesitation or lack of communication that we tend to think that we have to live in an environment where everything we must do that as we present it. But sometimes like a little bit of communication goes a long way.
Yeah, absolutely. And boundaries, right? Knowing where your client is, communicating those and then holding to them, knowing where that's going to be, and you kind of deciding that on the outset, 100%. And it's a kid's book. Everybody poops, right? It's everyone else that's the thing, right? Like it's a universal thing. You're not talking to someone who hasn't experienced whatever you're going through on some level, right?
Correct.
I will literally apologize to me. I ask them how their bowel movements are, and they apologize to me before talking to me about them because it is seen as so, to your point, impolite. Like this is, clinical intake, and I asked you about it. I want to know. It's what I do, all day long, and it tells us a lot of data about you, right? So. I think reframing that, to your point, and kind of desensitizing ourselves to those conversations, especially to save lives ultimately too, right? If someone is having these crazy changes in bowel patterns or things that warrant a workup at the doctor and they don't want to go because they don't want to tell anybody about it, or they do go to their annual and they just can't mention it, it really is putting folks at risk too. So I think making the topic more accessible is great.
Yeah. That's what we are doing next is, in addition to the podcast, we also create other videos, and another video is about the ultimate guide to bowel movement tracking. because
Right.
I what really want to do that is desensitize this topic, right? There's nothing to embarrass about this. Literally everybody in the world has to do almost every day, and everybody does it. And 40% of the world population suffers from it. And it's about time we talk about it. We talk about number of steps we have taken, number of the heartbeats we have taken, number of exercises we have taken. We have to talk like that because this is something that bodies daily record and symptom every day. It would be a great, health indicator.
Perfect.
So I'm really excited about that as well. So before we end this podcast, right, what we really want to also do is give out resources such as are there some checklists or some principles to go by. If you have any, on top of it, if you have those kind of checklists and resources, love to hear them out so that you can give away for people.
Some of the things I found when I was looking at this topic were I didn't love the language in some of just because I think that they were not the most helpful and a little challenging at times. I did find and I can send it to you in the show notes, it's a lot of what we talked about today with a little bit more too on ways that you can approach mindfulness during a holiday meal. So it might be a nice resource to go back to and look at. I think there were 10 ways to increase your mindfulness or things to consider specifically geared towards the holidays. So I can send that over to put in the show notes too.
For sure. And my framing is our body is a machine. We talk about input, processing, and output. And again, external environment, other stressors and all, just surrendering and accepting the way it is. And okay, what are my boundary conditions? Like what can I do? Okay, what is the cumulative risk that I have, and how can I reduce the cumulative risk one by one? And few things that I could do to improve my, improve my digestion or reduce my symptoms and so on. But that goes along. And as we said, right, everybody is a pilot of their own health plan, and we are there to support them, be co-pilot. Thank you so much, Danielle. And then Thanksgiving.
Happy
Enjoy.
Thanksgiving. Thanks.
Yep.
You too.
Bye-bye.